Welcome to EndyMed Pro, the advanced skin treatment system for body and facial tightening, body contouring, and fractional skin resurfacing. This brief video will help you achieve optimal results with your EndyMed Pro system. Remember, EndyMed Pro should not be used on patients with certain medical conditions. For a detailed listing, please consult the printed user manual. Before any EndyMed Pro treatment, ensure that patients remove all jewelry or other metallic objects they may be wearing. Following treatment, be sure to clean and dry the handpiece according to the instructions in the user manual. It's easy to achieve outstanding results with EndyMed Pro facial tightening if you follow a few simple steps. Before beginning the session, wash the area to be treated with a wet towel to remove any lotion or makeup. After photographing patients, position them comfortably on the treatment table. When you turn on the system, the initial screen appears and the system conducts a self-test. When the menu screen opens, select the Facial Tightening application. If the system tells you that the facial tightening handpiece is not properly connected, turn off the system and connect it now. From the Facial Tightening menu, select the specific area to be treated. The system will automatically set the default initial treatment parameters. Apply an EndyMed-approved ultrasound gel to the first square of skin to be treated. You'll apply gel to each successive square as you continue treatment. Position the handpiece on the first square of skin and begin moving it in a constant circular motion. Press the trigger on the handpiece. An LED illuminates to show that RF power is on, and you'll hear an audible signal throughout the time of energy flow. The RF pulse duration counter appears on the screen, providing a 30-second countdown for each pulse, after which the pulse stops automatically. Continue moving the handpiece in a circular motion for 30 seconds until the audible signal stops. During treatment, if the handpiece is not in full contact with the skin, or if you hold it in one place, the system will automatically stop. After this first trial pulse, check the skin temperature with the infrared thermometer, moving it along the X and Y axes at about 5 centimeters from the skin. Optimal skin temperature for facial tightening is between 40 to 41 degrees Celsius. If the temperature is too high or low, press the pause button and then use the plus or minus button to adjust the power in 2 to 3 watt increments. Then press the start button again and perform an additional 30-second pass on the same square. After reaching the desired temperature range, reset the passes counter to begin the actual treatment. Perform at least 6 passes on the first square before moving on to the next one. Continue from square to square in the same fashion, making sure to use enough gel so that the handpiece moves smoothly over the skin. If at any time the patient complains of a burning sensation, or if you observe excessive erythema or edema, stop the treatment and move to the adjacent square. The EndyMed Pro system offers you a choice of handpieces for treating different parts of the face. The system will prompt you to use the correct handpiece. Always turn off the system before switching handpieces. EndyMed Pro 3D Facial Tightening is easy to perform and pleasant for patients. EndyMed 3D Body Tightening and Contouring is performed much in the same way as facial tightening, with a few important differences. Before you begin, make sure the correct handpiece is attached to the control console. Always turn off the system before switching handpieces. With the patient standing, divide the area to be treated into 10 by 10 centimeter squares and mark their corners. When treating the abdomen, create 2 to 3 squares on the lower abdomen and 1 to 2 squares on the upper abdomen. If skin laxity in the umbilical area is prominent, add an additional square around the umbilicus. Position the patient on the back with the legs extended to make the abdomen fully accessible. Now apply an EndyMed-approved ultrasound gel to the first square of skin to be treated and perform the procedure according to the directions in the user manual, applying gel to each successive square as you continue. To treat the outer thigh area, position the patient face down with the leg to be treated folded towards the chest. For additional comfort, you may support the leg on a pillow. To treat the inner thigh area, position the patient on the back with the leg to be treated folded. To treat the flank, the patient should be positioned face down with the treatment area raised on a pillow. When treating the arms, they must be divided into 3 longitudinal sections: proximal, distal, and lower, each comprising a rectangle of approximately 100 square centimeters. We recommend overlapping adjacent rectangles. Treat the proximal part with the arm lying on the treatment table and bent in a comfortable position. For optimal contact, hold the handpiece parallel to the length of the arm and not perpendicular. Treat the distal part with the arm bent on the chest. Use a pillow if needed. The lower part is treated with the arm bent upwards toward the head. Because muscle thickness varies in different zones of the arm, you may have to adjust the power level to maintain an appropriate temperature range of 39 to 42 degrees Celsius. Continue treating square after square until you've completely covered the desired area. With EndyMed Pro 3D Body Contouring, your patients will see increasingly visible results as collagen remodeling occurs during the 2 to 3 months following treatment. Follow these simple guidelines to achieve the best results with EndyMed Pro facial tightening and body contouring. Check the printed user manual for comprehensive instructions. The EndyMed Pro FSR skin resurfacing system achieves fractional skin resurfacing together with skin tightening in a single pulse. Before treatment, make sure to photograph the treatment area. Wash and dry the treatment area to remove lotion and makeup. Then clean it with alcohol and apply a topical anesthetic such as EMLA for 30 to 40 minutes and leave it on throughout the treatment. The EndyMed Pro Skin Resurfacing Treatment Tip is intended for single patient use and must be replaced for each patient. After removing the tip from its envelope, hold it with 2 fingers on the grip on either side and insert it into the skin resurfacing handpiece until it clicks into place. When the menu screen opens, select the Skin Resurfacing application. The system will check if the skin resurfacing handpiece is properly connected. If not, turn off the system and connect it now. From the Control Console menu, select the desired treatment area. We suggest beginning with the cheeks. The system will automatically set the treatment parameters. Push the trigger on the treatment handpiece. An audible clicking signal and illuminated LED indicate RF emission. When the clicking stops, the pulse is complete. After the first or second pulse, inspect the patient's skin for 2 minutes. If you observe mild to moderate redness and edema, or the patient reports mild to manageable pain, then continue treatment with the same settings. In case of severe edema or excessive pain, decrease the time and power of the pulse by 10 milliseconds and 1 watt. If the patient doesn't feel the treatment at all and you observe no erythema or edema, increase the time and power by 10 milliseconds and 1 watt. Once the parameters have been adjusted, position the treatment tip in close proximity to the completed pulse and emit the next pulse. Repeat this procedure until the entire treatment area is covered. For additional effectiveness, you may cover part or all of the treatment area with an additional pass of pulses. If you choose to use a treatment template, place it on the skin using white eyeshadow and a sponge to mark the skin. When treating bony areas such as the forehead and temples, you'll need to reduce the power and pulse duration. See the user manual for complete instructions. Pulse time and power can be easily adjusted to suit varying patient skin types. For optimal treatment parameters, refer to the Fractional Skin Resurfacing Quick Guide. If you need to stop the treatment at any stage, touch the pause button. After treatment, if required, cool the area with an ice pack and apply a cream for superficial burns such as Biafine. Patients can immediately resume normal activities, including washing the face. Tell them to use a regular moisturizer, but more often than normal, to avoid sun exposure, and use a total sunblock for up to a month after treatment. Achieving great results with 3D skin resurfacing is easy if you follow these simple guidelines. For further details, see the printed user manual. Thanks for watching. For more information, make sure to consult the printed user manual that came with your EndyMed Pro system, or contact EndyMed customer support.